Welcome back. So we continue our coverage on the allegations of mistreatment of intern doctors at the Prince Mshiyeni Memorial Hospital. The KwaZulu-Natal Health Department says it's conducting an investigation into the death of an intern doctor at the hospital in Umlazi in the south of Durban. Dr Alulutho Mazwi died on Monday, allegedly after being forced to report for duty while ill. Well, I am joined by Ntokozo Maphisa, who is spokesperson for KZN Health. Ntokozo, good evening to you. Thank you so much for joining us. I think firstly, the Department of Health's reaction on Monday on the news of this intern doctor losing his life while on duty, even after reporting that he was gravely ill.
Greeting to you and your listeners. Thank you very much for the opportunity. We must say that we are a province that is mourning because this week we've lost 3 doctors, one in Gwelezane, one in Eddington, and one in Mshiyeni. But we've also lost 1 radiographer. The MEC for Health also sent the words of condolences to all the friends and families who were closer to this health professional. Getting into the case that we are talking about, we've received the allegations, and the department is taking these allegations very seriously, such that the MEC for Health sent a team of senior managers from head office to go there and find out what is going on there. Upon getting there, they found out that there were allegations that were made, and then they advised that it would be better so that there's no finger pointing at this time, that we come up with an investigation that will give us exactly what happened. So at this stage, we have appointed 2 senior investigators who will start tomorrow to investigate what really transpired at Mshiyeni. Yeah. So we are treating these allegations very seriously, and MEC said that he wants no stones to be left unturned there.
Yeah. You know, we heard from the family just within this hour on Channel 405, and one of the things that we heard was that this young doctor, 25 years old, had been studying obviously for many years and had started, you know, his work at this hospital at the beginning of this year. So really, after many years of hard work, really starting to begin his career. So I imagine that the family wanting to get answers as quickly as possible. So time frames that you can communicate certainly to us and to the family around the answers that the family desperately wants to get.
Yes, we will be pushing. That's why we appointed 2 of them. We will be pushing that at least if they can give us a week. Obviously, as you have heard from the unions and other people who are talking from social media, there are so many of these allegations, but we gave them a tight scope so that they can come back to us even before the end of the week. However, they will look at the scope and advise how much time they will need, but it shouldn't be more than 2 weeks.
The Public Servants Association, we also spoke to earlier, said that they have been in communication with the Department of Health at various levels, wanting the issue of what is happening with the state of that hospital to be looked at, whether it be infrastructural challenges around resources, but also around staffing, where they believe that there is autocratic rule at that hospital, that interns are being mistreated and working with very vulnerable patients without anyone overseeing what they're doing, and said that they have not gotten enough of a response from authorities. What do you say to that?
No, we said that the investigation will look at all those issues, and obviously we do have a space where we sit with unions and different stakeholders, such that recently MEC for Nomagugu Simelane had meetings with unions over and above letting them through chamber, where she was saying, let us get the gist of the issues that are happening on the ground so that we understand. But we are also on the ground. We do go to these institutions and try and find out what are their issues. Where we can resolve issues, we do resolve them. Where we need help from outside, we go out and ask for help. But even with this matter at hand, we will investigate it, we'll get to the gist of it, and then we will come back with the answer.
Prior to the death of Dr. Mazwi on Monday, as the Department of Health in KwaZulu-Natal, what was the last update that you received on the state of Prince Mshiyeni Hospital and some of the challenges that it faces? So what is the status update that you had on how that hospital was functioning before the death of this young doctor?
In the recent meeting that we had with one of the unions last week, Mshiyeni was one of the matters that were on the table, where MEC was having a one-on-one meetings with the unions, because her open door policy also allows unions to come and talk to her through these stakeholder meetings that she conducts with the union. So Mshiyeni is always on the top of the issues that we always deal with.
Apologies, I'm just stepping in, Mr. Maphisa, just because of the interest of time. So from the position of the Department of KZN, and you talk about the last status update you had was last week in engagements that you had with a union. But as the Department of Health yourself, when last did you have an official, prior to this incident, visit the hospital that seemingly has so many challenges that unions have felt they needed to step forward to talk to you?
As you might have noted that recently there were a lot of issues around the shortage of water in Umlazi. We were frequently there in that hospital. So we do go. The fact that in one of our strategic meetings where MEC met with district directors, she gave them a directive that they must meet and they must visit hospitals on a weekly basis. So Mshiyeni is one of the hospitals that is visited by head office, visited by the district, even on a weekly basis in some instances.
Okay. And just for a point of clarity, if you will, Mr. Maphisa, before I release you, you did mention at the beginning of our discussion that the KZN Health sector losing 4 health practitioners this week, 3 doctors, of course, Dr. Mazwi in that list, but also a radiographer, Mvelo Cele, who I believe died while on duty at the Port Shepstone Hospital. Do you know the details of what led to that radiographer's death while on duty?
We are about to receive the information in that regard, but we received the information that she was at work. However, we are waiting for the report that will give us proper details of what happened there.
Yeah, and we do look forward to getting those details as well. Thank you so much for speaking to us.